The limits of telemedicine in timely diagnosis and treatment of disease. Introduction. Telemedicine is becoming more prevalent since the onset of the COVID-19 pandemic. While it offers many benefits, there are also challenges to diagnosing patients through virtual or telephone encounters. So for our case today, we have a 64-year-old man with a history of ischemic cardiomyopathy, paroxysmal AFib, chronic kidney disease stage 3, hypertension, and a history of prior CVA, presented to the clinic with a large left-sided neck mass. He first noticed the mass about 6 months prior to presentation to the clinic, and it started as a small area of swelling but had continually grown larger since that time. He had not had any trauma, stridor, shortness of breath, tenderness, fevers, chills, unintentional weight loss, voice hoarseness, dysphagia, or odynophagia. His employer was the one that sent him in to be seen at the clinic because he was very concerned for his health and would not let him come back to work without being seen. Of note, the patient had had 2 visits with his primary care provider in the time since the mass had appeared, but these were done by telephone visit due to COVID-19 precautions, and the patient had not reported any symptoms of a mass at that time. So for the clinical course, his initial laboratory workup was significant only for a mild stable anemia and stable CKD. Imaging showed a large infiltrative soft tissue mass involving the left neck with significant local regional mass effect, and that's represented here in figure 1 with the image from the CT scan of the neck, and the arrows indicating a mass abutting the head of the left mandible and showing significant local effect, including effect on the airway. The patient was referred to otolaryngology and interventional radiology for biopsy, and the biopsy was consistent with a follicular lymphoma. Further imaging on staging showed additional involvement of the axillary and inguinal lymph nodes, as well as likely ocular involvement, and that is represented here by figure 2, showing a representative image from the MRI of the orbit, and the arrows indicating lateral rectus muscle involvement. After this, the patient was referred to oncology for further evaluation and treatment. So for the discussion, the COVID-19 pandemic has drastically changed the way that healthcare is being provided. Many systems, if not all, are now utilizing more virtual and telemedicine visits in response to the pandemic. Benefits include better access to medical providers, reduced time and monetary costs to patients who no longer may need to take a whole day off work to go to a doctor's appointment or need to find and pay for transportation to go to the hospital to see their doctor, who may be able to do it in the comfort of their own home now. And of course, reduced exposure of both the patients and the providers to the SARS-CoV-2 virus. There are some challenges to implementing telemedicine, and these include needing to have good infrastructure to hold these visits at your facility, including internet access. And this is true for patients as well, and potentially more important, patients need to have good internet access, whether that be high-speed broadband, high-speed Wi-Fi, good internet data plans on cell phones. They have to have a good connection. They also have to have the hardware to complete these visits as well, a computer, an iPad or a tablet, or a smartphone, or at the very least for a phone visit, a telephone. And this kind of shows how there's a potential for impoverished or underserved communities to be at a disadvantage here, because not everyone may have access to some of these things in rural communities as well. And there have been privacy issues brought up in cases where people or services have been using video services that are not HIPAA compliant. And as seen in this case, there can be limitations to the use of telemedicine visits, particularly in this case, as a telephone visit, you are not able to examine your patient at all. And even in video or virtual visits, you have limited ability to examine the patient other than just what you can see on the outside. And this can lead to delayed diagnosis and delayed treatment of potentially serious disease. So in conclusion, telemedicine is becoming more prevalent due to the COVID-19 pandemic and offers many benefits to both patients and providers. However, there are limitations to telemedicine visits that can contribute to negative outcomes or delayed diagnosis for patients. Thank you.